Um, anyway, as you know, the International AIDS Conference that the IAS is the custodian of will take place this year in Washington, D.C. From the 22nd to 27th of July, so it's just in 2 months and a half from now. And it's very important for us to keep you guys informed of what will happen at the conference and what could happen after the conference as well, as we'll move on trying to implement what we'll discuss at the conference. So the conference brings together 20 to 25,000 delegates from around the world. I won't go into details on who comes to the conference because Anouk will do that just after me. But it's important for you to know that we're actually returning to the US after 22 years. The last time the conference was organized in the US was in 1990. And then we chose on purpose not to go back to the US because there was a travel ban for people living with HIV on entry to the United States. And this travel ban has been lifted 3 years ago now. So we made the choice to actually return to the United States to acknowledge for this important change in human rights for HIV-positive people. This conference will take place at a very important moment in the fight against AIDS. You know that 30 years after the start of the epidemic and 10 years after the start and the launch of the Global Fund to fight AIDS and tuberculosis and malaria that is also based in Geneva, we now have 6.8 million people on treatment in the world, which is about half the people who urgently need treatment. And that's actually an achievement if you compare to 10 years ago where in developing countries, a few 10,000s of people had access to treatment. At the same time, the same number of people still need access to treatment urgently. You may have heard of the latest scientific advances that we discussed in the Rome conference last July on the efficiency and effectiveness, I should say, of using treatment as a prevention tool, and the fact that when you put HIV-positive people on treatment early, their infectiousness is decreased by 96%, which means that a larger access to treatment in the world could decrease global infectiousness and what we call community viral load, and would be one of the best means to decrease the number of new HIV infections in the world in the coming years. So that's the good news. The bad news in the last 12 months is that we're facing a huge financial and economical challenge in the fight against AIDS, that the Global Fund is facing challenges, that a few governments are trying to retract from funding HIV/AIDS programs, both at prevention level, at access to care and treatment level, and at the scientific level as well. So we're in a moment where we have to mix those news, good news and bad news, and try to find the way forward. The conference is one of the biggest gathering of healthcare providers, health scientists, and health communities in the world. And it's the only moment in the fight against AIDS where everyone comes together in the same place and at the same moment. So what we'll try to do in this conference is try and keep HIV high on the agenda of decision makers and political leaders, keep it high on their agenda or put it back high on their agenda for some of them, so we can actually face more solutions than challenges after the conference. The theme of the conference reflects this kind of thinking. We chose as a theme turning the tide together, just because we have the feeling that if we find the right commitments, the right political commitment, the right financial commitments, with the latest scientific advances that we have and with all the progress that we've made in the past 10 years, we have actually the means to see the trend go the other way than it's gone in the past 20 years and actually have less new infections in the world and have less people living with HIV in the world in 15 or 20 years' time. The main part of the conference, of course, will take place in Washington, D.C. We're also organizing hubs for some groups. Two of them will take place, one in Calcutta with sex workers networks. I think you'll touch upon it. You will, Anouk? Okay, so I'll do it. So we're organizing it with the Global Network of Sex Work Projects, just because we believe that it's important that key affected populations can come together and take part in the conference, and we know that some of them will have challenges being permitted entry to the US. So we want to make sure that sex workers on one side and drug users on the other side will have a means to take part in the conference. So we help them organizing those two hubs, one in Calcutta for sex workers and sex workers organizations, and another one in Kiev in Ukraine for drug users and drug users networks and organizations. That we organize with the Eurasian Harm Reduction Network. And I don't know if you say Eurasian because I'm French, so I say Eurasian normally. I also have to tell you that we agreed recently to add two new plenary speakers. One of them is Linda Scruggs from the AIDS Alliance for Children, and the other one is Debbie Macmillan from the Transgender Health Empowerment. We're up to 17 plenary speakers now. High-level speakers, obviously, coming from very different backgrounds, from basic science to, again, political leaders, decision makers, community representatives. And we want to make sure that communities have their say in all the topics that we'll discuss in that conference. And we sent you a press release with a list of plenary speakers last January, I believe, and so we'll update it after this press conference with a new complete list. And we'll announce a complete list of high-level speakers early June. We're still discussing with some of them, and especially political leaders, whether they can come or not to the conference, and what they want to talk about and what we want them to talk about. So that's a decision that we'll make this month and announce early June. Okay, with that, I'll hand the mic to the conference director at IAS, Anouk Ray.
So as Bertrand mentioned, the conference has been going on for a while. It started in '85 in Atlanta, and it has been, as you can see, going around the world. We usually try to go to developing countries and developed countries. So you have the list there. Our partners, so we have international partners that are some of them permanent for every conference. UNAIDS is one of them. The International Community of Women Living with HIV and AIDS is another one. The International Council of AIDS Service Organization, and also the Global Network of People Living with HIV. And then we have other international partners that are with us for a couple of editions. CVC is one of them, and SIDAction. And then for each conference, and for DC in particular, we are partnering with organization locally, meaning in the country. And so you have the list there. We have the District of Columbia Department of Health, the White House, Black AIDS Institute, Positive Women Network, National AIDS Institutes of Health, and the HIVMA. Basically, we try to have two scientific, two community, and two leadership local partners. We can drop that. So in July, we are expecting over 20,000 participants from over 200 countries. 2,000 of them will be media. We are probably expecting 1,800 students, 150 exhibition booths, 680 speakers overall, 900 scholarship recipients. Those are the people that we pretty much pay for to come to the conference. And also there'll be a lot of staff, organizers, and volunteers. So far, we have already 10,000 registration. You have the breakdown here. I don't know if that's really interesting to you, but one thing is that almost 40% are coming from middle and low-income countries. Our registrations this year are up 36% in comparison to the last two editions, Vienna in 2010 and Mexico City in 2008. We have almost 40% coming from the US and Canada, 37% from the US alone. And this is the breakdown per region, so truly an international event. We are also expecting a lot more exhibition than usual, a lot more satellite meetings than usual. We have a lot more affiliated events as well than usual. There's truly an amazing enthusiasm and a lot of expectations for this conference due to the fact that we haven't gone to the US for over 20 years. Those are some of our sponsors and some of our donors. You can find the full list of our donors, sponsors, supporters, and partners on the website. But these are a few of them. In terms of fundraising, you may know that the conference budget is of about $22 to $23 million US. Almost 4 million come from the major industry sponsors. 11 million are being fundraised. So you see from foundations, from countries, from the private sector, and also other sources. And then the remaining 7 or 8 million are coming from the registration to the conference. We are expecting activists, UN representatives, governments, healthcare workers, media, people living with HIV, of course, policymakers, scientists, and basically anybody who is close or far linked to the HIV and AIDS epidemic. We have two secretariats to organize this conference. The International Secretariat, where we are all based, is here in Geneva. And then we have one local secretariat in DC that is open for 2 years with mainly temporary staff that help us with the different aspects, whether it's program or communications or logistics on site. So I think my presentation is done. I'm now introducing